This is my first social sciences conference, and I was told that tell a story. And as a medical academic, I have never gone on stage and told a story. So the story involves you all doing some imagination. This is like a thought exercise. So social sciences crowd, doctor, let's reverse the roles. You all are doctors now, and you're sitting in your clinic and you have a young couple come to you. This young couple is like an average, the typical Indian married young couple, heterosexual, conservative families. And oh yeah, you're fertility doctors, by the way. And you have a conversation with these guys, and you notice that after running some basic investigations, this couple looks fertile, great sperm count, great egg count, everything looks like top notch. The couple tells you they've been trying to have a child for the past 7 years and they've been struggling, which, with the previous data doesn't really match up, and you're confused. So what you do is logical next step, you go to the husband and you ask him what you're doing. And it turns out that the husband tells you that for the past 7 years, they have not been able to conceive because he has been penetrating his wife in the belly button. Because बच्चा पेट से आता है, पेट में छेद है. Logically, that's where things are going to go. This sounds like something really ridiculous and something that may not be true, but this is a story from 25 years ago. This is a couple that I know. I know the child that was born out of it. The doctors in question here are my parents, who are also fertility doctors, and this is a story from 25 years ago. Now, another thing I want you to imagine is you're picking up your phone, you're scrolling on WhatsApp, and you see a message that says, if you wash your hair on your period, your uterus is going to swell. And you're going to get cancer. And this message is coming from some big hospital in Bombay. Now, this might sound really ridiculous, but this is a WhatsApp forward that goes around to this day. It started going around when I started accessing emails when I was about 12 years old. I'm 29 years old now. I see this WhatsApp forward every other day. Quite popular. And this is the story of sex education in the past, in the present, and what it might be in the future. So you might think that these problems are extremely Indian. We have nobody in the West is penetrating their wife in the belly button for 7 years trying to have a child. Nobody is getting concerned about washing their hair on their period and getting uterus cancer or whatever like that. This is not how it is. I went to do my master's in the UK, and I saw that the problems that exist in India as far as sex education goes are the problems that exist globally. The kind of questions we have in the West are the same kind of questions we have in India, except they're a little bit more fundamental. Belly buttons in question. The problem here is that there has been a very unfortunate and a very serious lack of sex education, and not just sex education, body literacy. Last year, I was doing a panel with some older women in the US. It was, I used to live in Texas, by the way, for context. These were all Indian women, and they were all in their 50s or 60s. Didn't do anything in that panel except make them say the word vagina. That's it. All they had to do was name a part of the body. Can you imagine doing a panel with about 100 people and asking them to say nose, nose, nose? You later and crying because they've never said the word nose in their life. Because there's so much inherent shame in the idea of naming these body parts, or finding empowerment in these body parts, or normalizing conversations about these body parts. That's what happened to me. A couple of women came to me later and cried. 60-year-old women, twice my age, telling me that they've never said this word in their life before, which contrasts with what I do on the internet, which is say this word about 25 times in 30 seconds. And you might think that because I talk about sex, I was catapulted into fame very, very quickly. But that's not the case. I mean, obviously, yes, sex is an attractive topic. Everybody wants to learn about it. Everybody wants to talk about it. But I feel like these examples might highlight how dire the situation is and how poor the conversation has been around our bodies, and the idea of literacy around our bodies, and just accepting our bodies the way they are. Now, sex education is not a new concept. It's existed for, well, millennia. I come from India. But the problem has been that the sex education we've received has been so Western. the problems we've learned in our sex ed have been so disconnected. There's no nuance, there's no cultural nuance of what it might be, to what kind of problems you might face as a person living in India. Our problems are like public toilets. How do you pee in them without hovering? Do you sit down on them? Is it safe to do that? Can you catch an STI or a UTI from a toilet seat? Our problems are more along the lines of, I did medical school and then I did another master's in the West, and I had never seen any representation of my skin pigmentation in any of the medical textbooks or in any of the educational literature I had received that was supposed to be inclusive and diverse. And I had never seen a brown vulva, ever. I had never had any explanation on why there is pigmentation on the inner thighs, why the vulva is darker, why the penises are darker, why the scrotum is darker. And in people of color, why there is this pigmentation and the kind of horrid things we do to our bodies to cure this pigmentation, or at least the kind of horrid things YouTube videos suggest you do to cure this pigmentation, including rubbing lemons on your genitalia. I do not want to know how that goes. But there are enough young people who do these things and who end up hating their bodies and who end up almost treating bodies that are not of color as something aspirational, because this is the only representation we've seen. All of the sex education we've received in the past has been not to an Indian context. And what I love absolutely is the fact that the West has taken a lot of our cultural practices, picked it up, rebranded it, put a nice little bow on it and sold it back to us. I'm talking about Sri Sri Gwyneth Paltrow, with the jade eggs and the vaginal steaming and whatnot. And, it's so unfortunate that, sure, there are problems with these practices by themselves, but when somebody comes and takes your own cultural practice and rebrands it and sells it to you to profit, that's even worse. So what has been a huge, huge problem so far is the fact that there has been no nuance in sex education or body literacy content or literature as far as our kind of people go. We don't have answers for our problems, our very, very specific problems. I went through all of medical school. My mother was a gynecologist. I had never heard of the word vaginismus before. And vaginismus is a medical condition in which the vagina closes shut at the thought of penetration. So it can be anxiety inducing and the vaginal muscles just clamp shut. It's a very common condition and it's not talked about at all. Daughter of a gynecologist. I've been attending gynecology conferences since I was like this little. And I've never heard of this condition. So what I've seen so far, and this is going to be very different from the doom and gloom we heard over the past 2 days, as far as social media goes, is that this kind of community building and this kind of experience sharing, I have not found in our culture before. So what sex education on social media has done is that it has created this space, and there's lots of very wonderful people working in this space along with me who have created this idea of normalizing conversations around our bodies, because we all have bodies. And one of the things that, out of the multiple things that divide us, one of the things that unites us all is that we're all insecure about our body in some way or the other. Something always lingers in our mind, taught to us by popular culture and media, that this is how you should look and this is how it should be, but it's never like that. And, aside from like just life affirming positivity, there've been some real magnificent changes that I've seen that I am extremely proud of. There's a vaccine called the HPV vaccine that I'm a big proponent of. So HPV is a sexually transmitted infection, and in some people it cannot be cleared. Most of our immune systems clear it out, but for some people it doesn't get cleared out, and it leads to a very common cancer. So it can lead to cancer of the cervix, which is the bottom part of the uterus. Also leads to cancer of the back of the mouth, of the anus, of the penis. I think Michael Douglas mentioned that he got throat cancer from unprotected oral sex and catching HPV there. So HPV story aside, there is one vaccine that is there that can prevent the most common cancer-causing strains of HPV that can protect you from it. And that vaccine is a part of the national immunization protocol in some countries like the UK. And what they've seen over 10 years is that they've had a 90% reduction in, the instances of cervical cancer they were noticing. We don't see these kind of numbers in medicine routinely. 90% reduction over 10 years is dramatic. And yet this vaccine costs 9,000 rupees in our country. You need 3 doses for it. So of course, we've created a big movement and we're just really pushing for it. We're asking the government to subsidize it. We're asking the government to make it a part of the national immunization protocol in India as well. But there's a personal story why this means so much to me that I would love to share with you. And I hope you all can go to your friends and tell them to get vaccinated against HPV if they live in the States, or even if they live in India and they can afford it, or hopefully when the cheaper vaccine comes out in the market. I didn't know that creating 90-second reels could have this impact, because one person wrote to me that they went to get the HPV vaccine and after that their arm was sore for the next day, so they couldn't go to the gym. So the gym instructor was yelling at him, you're doing bahanebazi, you don't want to lift weights today, that's why you're telling me vaccine. And he said, no, there's a new vaccine I've heard about and I think you should get your wife to get this vaccine as well. The gym instructor listened to her, took his wife to the doctor the next day to get the vaccine. They found stage 1 cervical cancer. The thing with cervical cancer is the symptoms are so vague that it's often diagnosed very late. Symptoms are things like constipation or unusually heavy bleeding, which is not something you would think of, cancer, unless you're looking at WebMD. So this 190-second reel helped diagnose a cancer for somebody who otherwise wouldn't have bothered with going to the doctor, because these are not symptoms that alarm you anyway. It has been a massive win in so many ways, being able to create this kind of content and being able to have these conversations. And I think post-COVID, we've seen there's a very solid rise in interest in medical conversations. People want to be more health aware. People want to know more about their bodies. And I feel like doctor influencers or doctors becoming influencers has been a groundbreaking shift in the way we've treated doctor-patient relationships in the past. Because, there's an immediate hierarchy when somebody is coming to the doctor with a problem and, exposing their issues. And, there's an inherent amount of very deep trust that you have to entrust somebody with to tell them your problems and your concerns, and for them to literally invade your body. In India, that hierarchy is even more pronounced because of the kind of ratios we have between patients and doctors. There's very few doctors for a very large number of patients. And as the liver doctor will tell you, a lot of them are frauds. Not alternative medicine specialists who come from, unfortunately end up exploiting a lot of patients, which means that the greater burden of healthcare is very significant on the very limited number of doctors we have, which means that doctor-patient interactions are often very tilted and very quick. And there's no time for, a deep dive into your health, which I think social media has changed and challenged in such a beautiful way, because there's finally some two-way communication. There's finally some feedback. There's finally some receptivity from our community in being able to find the time to listen to other people's problems. In medicine, I never learned that patients care about, whether or not to sit on a toilet seat and pee, because can you catch a UTI from it? I was taught the complex mechanics of how a prolapse works and how I should drill into my patients to do their Kegels to ensure that they don't get a prolapse. Simple, actionable health advice is something that has been missing, and I'm very happy to see that there is this movement. And I might sound ridiculously optimistic about this, but I truly am. The kind of impact that social media has generated for health advice has been phenomenal. And, I'm really happy to see it. So we need to de-jargonize, we need to decolonize, and we need to democratize this kind of information. And, I've told you about the past, I've told you about the present. Future is up to you all. Future is up to more creators. Future is up to more scientists and, academicians translating this jargon-heavy technical information for other people. Because I think there's something very wonderful Saurabh ji said yesterday. He said, "Rone ka time nahi hai." So रोने का time नहीं है, and it's time for more action, and it's time for more medical content creation. Thank you.